The member for Pascoe Vale.
Thank you, Acting Speaker, and it's good to see a fellow member from the North in the chair, as always. And I too rise to speak on the Health Legislation Amendment Regulatory Reform Bill of 2024. And I'd just like to begin by just acknowledging, like others have, just the vast array of contributions and experiences that have been shared in the chamber today throughout this debate, particularly those from the member for Ballerine, the member for Laverton, the member for Point Cook, who's in the chamber as well. Those deep personal stories and experiences that I think we can all acknowledge and sympathise with. But at the other end of the debate spectrum, I guess, we've seen the member for Warrandyte give a gender reveal. I think that's a first for the chamber, but that builds on as well, let the record show, the member for Preston's former, at the start of this parliamentary term, marriage proposal as well. So we've had a marriage proposal, we've had a gender reveal. I don't know where this is leading, but there are quite a few couple of feats in this parliament that we've experienced. And I'd also like to commend, of course, the Minister for Health, her team, her department, the relevant stakeholders for bringing this bill to the House. And I'd also like to commend, of course, as we are here speaking, all the health workers that are proudly keeping our health sector running, many of whom are represented by the Australian Nursing and Midwifery Foundation, the ANMF, and the Health and Community Services Union, who are in the building as we speak, HACSU. And of course, I'd like to acknowledge all the health workers across my community. There's almost 13,000 residents across Merri-bek in my community, including Pascoe Vale, Coburg and Brunswick West, that work in the health sector, social sector or community sector. Almost 14% of local residents work in health or community services. It's the highest employment sector in my community, and they do an absolutely incredible job, particularly like those at Merri Community Health, who I'd like to touch on as part of this contribution. And I'd like to say as well that I'm proud to be part of a Labor government and indeed a Labor movement that's always fought and stood up for universal access to healthcare and the health and wellbeing of every Victorian. Because of course, regardless of postcode, bank balance or circumstances, Labor's always been a strident defender of the community's right to access public healthcare, medicines, treatments and supports. And whether it be, of course, through the creation of Merri-bek under the Whitlam government, creation of Medicare under the Hawke government, the establishment of NDIS under the Rudd-Gillard government, or of course laying the foundations for today's modern pharmaceutical benefits scheme under the Curtin Labor government back in 1944, access to healthcare is really ingrained in the DNA of the Labor movement. And it's also at a state level that Labor has continued to work, including through this bill, which I'll turn to in a moment, to invest and support the public's access to healthcare, treatment and support via our public health system. Since 2014, of course, we've invested almost $60 billion to deliver world-class healthcare, better facilities and the latest equipment across our entire health system. Invested a record $20 billion in Victoria's hospitals. This year alone, it makes up more than 25% of the state budget. Recently as well, we've announced, of course, an additional $1.5 billion towards supporting our hospital system. That's on top of upgrades for the Northern Hospital and the Austin Hospital, $813 million for construction of a new emergency department at the Northern, and of course $275 million to expand the capacity of the Austin Hospital. Again, a new expanded emergency department and paediatrics unit as well. Our public surgery waiting lists are now the lowest they've been since the pandemic, with almost 210,000 planned surgeries performed this financial year, driving the wait list down by 33% since 2022. Since coming to office, we've of course also grown our health workforce by 40%. That's 60% more doctors, 36% more nurses and midwives in our hospitals. And we've of course made it free for 10,000 students to study nursing and midwifery, and we're implementing a stronger nurse-to-patient ratio across the public system. We've established priority care clinics, now known as urgent care clinics, to relieve pressure on hospital emergency departments, which are averaging 7,000 patient visits a month through the urgent care clinics. That's 500,000 patients they've seen and treated since their inception. And of course, we've also reformed 000 Victoria. We've sustained the Nurse On Call hotline. We've established the Victorian Emergency virtual department as well, many of whom have been trained out of La Trobe University as well. We've supported community pharmacies, rolled out the pharmacy pilot, and all of this is helping to relieve pressure on GPs, on hospital emergency department, and of course our hard-working emergency services. And Acting Speaker, this bill before us today will help us continue to build on this work to build a better and fairer health and wellbeing system for all Victorians. This bill, of course, as we've heard, contains a number of provisions. It is, in fact, an omnibus bill. It will essentially enable the health regulator to more effectively minimise risks to the health and safety of Victorians via a number of things, including amending the Drugs, Poisons and Controlled Substances Act. It will also amend the Public Health and Wellbeing Act of 2008. It'll amend the Epworth Foundation Act of 1980. It'll amend the Safe Drinking Water Act as well, and we heard the member for Mildura and the member as well for Yan Yean, I believe, speak substantively with respect to that, so I'll refer members to those contributions to hear and learn more about those changes. And there's also quite a number of other technical and minor amendments to reflect machinery of government changes contained as well. But perhaps the most substantive and meaningful reforms contained in this bill that will impact many, many Victorians today and in years to come relates to the changes to the Assisted Reproductive Treatment Act, which will improve the regulation of assisted reproductive treatment to better protect Victorians, simplify access to information from the donor conception registers, and reduce unnecessary barriers related to accessing donor gametes, including sperm, eggs and embryos. And Acting Speaker, Victoria has long been a leader, as we've heard, in the provision and regulation of assisted reproductive treatment. The first Australian IVF baby, in fact, was born here in Victoria back in 1980. And just recently in 2020, 4 years ago, the Royal Women's Hospital celebrated the 40-year anniversary of the first IVF baby, Candice Reid, a major milestone, of course, in science and fertility for this country. The pioneering team at the Women's Hospital, where I was born as well, mind you, led by the late Dr. Ian Johnson, who ran the hospital's infertility clinic, was able to achieve Australia's first IVF pregnancy in 1979, which led to Candice's birth on the 23rd of June 1980. And since then, I understand, I've tried to do a bit of research here, but and this is the figures I can sort of bring together here with the time I had, but I understand that well over 200,000 children across Australia have been conceived or born via IVF, with the previous University of New South Wales report finding that around now 1 in 20 babies across Australia is born via IVF. That's around one child in every classroom. But the stats also show the overall live birth rate per embryo transfer is just over 27%, and that's increased from 24% on previous years. So that illustrates that for every successful IVF birth, there's still roughly around 3 or 4 unsuccessful IVF cycles that families and parents do sadly experience. And Speaker, of course, like I said, I acknowledge and commend families who've gone through or continue to go through the IVF process to conceive and start a family, and I acknowledge all those contributions from those respective members who have done so. Acting Speaker, Victoria was also the first jurisdiction in the country to provide legislative safeguards for individuals undertaking assisted reproductive treatment through the Infertility Medical Procedures Act of 1984. It was also the first Australian jurisdiction to recognise the need for people conceived through donor treatment procedures to have access to information about their genetic gametes, again with respect to sperm, eggs and embryos. And Acting Speaker, building on these previous landmark reforms, the Michael Gordon Review, which began in 2018 and completed in 2019, 10 years after the passage of the landmark Assisted Reproductive Treatment Act, have basically formed the basis for a lot of these changes here today. That legislation was quite landmark. It gave legal access to treatment in Victoria for single women and same-sex couples to enable altruistic surrogacy. And the legacy of these law reforms is clear, with thousands and thousands of Victorians since being helped to start families. But the 2008 Act itself had a long and difficult story. It began in 2000 when leading fertility specialist Professor John McBain challenged restrictions to Victorian legislation that limited IVF to married women, and ultimately in 2002 the High Court agreed that the Act was discriminatory. In response, the Victorian Government asked the Law Reform Commission to review these laws, and from 2004 to 2007 provided the foundations for the 2008 bill, which was presented to Victorian Parliament in mid-2008 by then Attorney General Rob Hales, and the bill was passed by one vote in the Upper House on the 4th of December 2008. And the reforms contained in this bill will also build, of course, on our commitment to deliver public IVF through a $70 million commitment and our work through the Women's Pain Inquiry as well. And with the time I have, I'd like to commend, of course, our community health workers at Merri Community Health. On the 6th of August, I had the pleasure to catch up with CEO Tasia Michalis and Chief Operating Officer Amy Jackman to get an update on their fantastic work to keep our community healthy, resilient and safe. As one of the longest running community health organisations in Victoria, established over 45 years ago and operating across a number of sites across Merri-bek, employing 400 plus health and community workers, Merri Health and their team do an amazing job in looking after our local wellbeing. They provided over 266,000 service instances the last financial year, supported over 17,000 carers across Victoria, provided dental care for children, over 1,000 children, mental health and wellbeing support to older residents. They've launched a new School Ties program for young people impacted by COVID. I've previously had the Minister for Health actually come along and visit to have a look at their work to support and assist with chronic pain. I've also welcomed the former Minister for Mental Health and the Parliamentary Secretary for Mental Health, Tim Richardson and Minister Williams, previously to to look at their work in mental health, and it's in that spirit that I truly commend this bill to the House on behalf of our local workers.